670 WOCA.
Ocala.
5 minutes after 11 o'clock. Beautiful Thursday, the 6th day of July. Wow. We're just about a month and 2 weeks away from that full eclipse, right? What do they call it?
Yeah.
Solar eclipse, right?
Yep.
The sun's going to go away for 2 minutes. You know, this business is a business where you have to have your voice. And I can remember, and thank God, knock on granite, that I don't have them anymore, but I used to get these amazingly horrible sore throats. And I was up in New York, and I went to this doctor who had been like a World War II doctor. And so he didn't give you medicine for anything. He said, just deal with it. You're going to deal with it. Hi, yeah. And he had this this very German accent. And so it was kind of hard to argue with him. Dr. Jose Jiron is the guest of Lauren Debick. And Lauren, of course, is from Ocala Health. Good to see you again, Lauren.
Good to see you, too. Thank you for having us.
How are you?
Good.
You hate the summer?
I just said I'm looking forward to fall, is what I said.
Yeah. Dr. Jose Jiron is in the studio. And I did practice this for about a minute. Otolaryngologist?
That's correct.
How'd I do that? Okay.
Yes,
and
perfect.
You're with Ocala Health, and you specialize in the ear, nose, throat, and all that stuff in our heads?
That's right.
Wow.
It's a long process.
How did that happen for you? I mean, how did you settle on that as a specialty?
Well, you know, when you go to medical school, you do rotations, and one of my rotations was in surgery. And prior to that, I had done research at St. Jude Children's Research Hospital. And
With children?
With the children.
Oh,
and
wow.
So
Yeah.
they were doing this very big neck surgery. And
Oh, my
you could see
gosh.
the carotid arteries and all these different nerves. And I just went up to the doctor and was like, what is this?
No
it's
way.
amazing. And he was like, this is
Little child?
otolaryngology. Yeah. He had a cancer, a tumor.
Oh.
And so he was like, this is ear, nose, and throat, otolaryngology. Do a rotation. You'll love it.
Oh my gosh!
And that was
Do you
it.
know, Robin and I are supporters of the Children's Craniofacial Association, and I'm guessing you work with that kind of a patient all the time.
Well, some of it. You need more specialty for that.
Is that right?
In regards to cleft lip
Wow.
palates and cranioplasties, but some of them.
We've
some
known
of them.
children 75 surgeries, and they're
Yep.
not even
Yeah.
8 years old. It's like unbelievable.
A lot of reconstruction.
Yeah,
Absolutely.
Yeah, and the people who have your skills are the reason they're even living.
Yeah, they do a great job.
So while I'm complaining about a sore throat, I mean, they are fighting for their lives.
Perspective, that's all it is.
Wow. So
right.
who are your clients, patients normally?
Well, typically, obviously, in the area, it's an elderly population. We
Yeah.
see anywhere from typical patient includes sore throats from children being needing tonsillectomies.
Oh, okay,
Sore throat
okay,
that could be
okay.
induced from cancer. Sore throats that could be from reflux related, to just a lot of allergies in the area. The sneezing, the sniffles that most people get, to hearing loss, to a lot of neck masses and concern for cancer is
Really?
our broad
Really?
spectrum.
Do you still put tubes in children's ears? My daughter had to have that done because she was almost going deaf, and she was
Absolutely.
like 2 years
so,
old.
yeah, we do a lot of ear tubes, and the indications for tubes are just recurrent infections. So in children, anywhere between 6 months to about 3 years who have recurrent infections, more than 6 in a year or more than 4 in 3 months, those are indications. Or
Really?
having fluid that is not going away after 3 or 6 months.
Because it's when there's something in your head, it's horrible.
That's right, it feels terrible.
Everything. In your elbow, it's hard, but the head is worse. I mean, it's right there. It's like you live in your head.
That's right, you can't
Right?
function. People
Most of the
feel
time.
disoriented, they don't feel
Yeah.
themselves.
So do you have? Is it the same rule of thumb as with most conditions? The earlier you catch it, the better it is.
Yeah, so it depends though. Obviously for cancer, that's definitely a rule.
Yeah, sure.
Obviously the earlier you catch it, the more you can treat it and be able to cure it. Sometimes there's things that linger for a while that you can improve it but not fully make it go away. And for example, like smelling, as we get older, we tend to lose smell.
I thought you were going to say we start to smell.
We tend to lose smell.
I do when I sweat.
And
Well, maybe that's why we lose it, because we start to.
and therefore that you can't really fix that, unfortunately. But you have to rule out other things as well.
Oh, really?
Well, my son TJ has was diagnosed with a thyroid problem,
That's
and
right.
usually he'll get sick around December, around the Christmas season. Does that have anything? Do you help that too?
Well, we help with thyroids, and usually we help with any masses in the thyroid, nodules, concern for cancer and malignancy. Thyroid nodules are usually seen in females,
Oh,
and usually anywhere between 30 and 40. For some reason, the body attacks itself.
Really?
And the thyroid just builds some nodules. But there's other medical problems with the thyroid that can be improved with medications. But in the surgeon side, the ENT side, we just see the neck masses that need to be removed for concern for cancers.
Are there any common things that maybe just being on the radio you could help somebody with? Maybe sinus headaches, that kind of thing?
Yeah, the sinus headaches is very controversial, and it's one of the things that we see a lot. The biggest thing is just the environment. We have a lot of allergens that from grasses, from trees, to ragweeds.
Right.
One of the biggest things that you can do, especially for those who don't want to take medication, is something more homeopathic, is saline spray, saltwater spray.
Oh, really?
The more you moisturize your nose.
Does that work?
It does. It gets all the allergens away and then moisturizes your nose so that your nose doesn't have those allergens that will make you sneeze, that will make you have the runny nose, that will make you feel congested, that makes you have the postnasal drip and the thick secretions.
Does that, what's it called, a neti pot? Does that work?
Neti pot, yeah, absolutely.
Yeah?
Neti pot, Neomed, those are really, when I see patients with allergies, I tell them that's one of the first two to go to.
Is that hard to learn to do? I watched the picture. It looked like a terrible thing. Have you seen this, Lauren? Mm-hmm. Oh, you made a face. You don't want to do it either.
I've done it before.
You have done it?
Neti pot? Yeah.
yeah.
It's really good. It's easy, and it's
It
one
is.
of the main things that you want to treat if you have allergies.
Really? And the water just literally, when you pour it in, when you pour it in one nostril and it comes
Lauren
out
and
the
Larry will have a
other.
tete-a-tete about
Where is it in the meantime? Like, where does it go before it comes out the other side?
So we have ridges inside our nose or
Yeah.
humidifiers called turbinates.
Yeah.
It just flows inside. And you have to understand, we have sinuses in between our eyes and in our cheek and in our forehead that it kind of roams around in there before it comes out.
Did you see this article yesterday about people snorting chocolate?
No.
Oh my,
Yeah.
oh my
Yeah.
gosh. Well, doctors were warning people, don't be snorting chocolate.
Yeah, I don't think that's a good idea.
Kill ya.
No, I don't.
It'll clog up your ridges. It said, I found
Yeah.
it. Oh, I got to find that story.
Saline spray. Use saline spray. Saltwater spray.
If a person tries to self-diagnose and self-treat, is that a good thing, or should they just come to you right away?
You know, that's a great question. You know, with the internet and, you know, a lot of people being educated, I think that's a good start, you know, within reason. You know, if there's a concern that lasts for more than a week, you should definitely go see a medical professional because there could be something worse. I'll give you an example. A patient came in with just pressure in the face, fullness in the right ear, and it's been going on for 3-4 months.
Oh my gosh.
Okay. Oh, it's just sinus and allergies. I ended up seeing them and ended up having a tumor. So within reason. So I think definitely give it some time, give it a week or two, see your medical professional within that time. But if it doesn't go away, they'll refer you to a specialist that can rule out the worst case scenario and hopefully make you feel better in the meantime.
Any of the old home remedies, like my mother used to put Vicks in this thing.
In vaporizer.
Yeah, and there'd be a vapor thing coming up. Does that still work, or did it ever work?
But it worked for me. I mean,
Did it really?
When my mom did it.
What happened?
It just made me breathe better. It's something within Vicks. Going along with the saline spray, there's a lot of people use ginkgo, a lot of grapefruit extracts.
Really?
All of these little things that can help you to kind of help reduce the inflammation, aloe type of things.
Well,
But it
can't you just
depends.
eat grapefruit instead of getting these grapefruit pills or something?
Right. Yeah, I'm sure you can. It's just all of these though are all very controversial because there's not much studies that go into them. That therefore you can't say definitively yes that works for that. But it's all anecdotal, meaning it helped me out, so maybe I'll help you out as well.
So I make the connection for me. The thyroid is it part of the throat? Is that why it's part of what you do?
So the thyroid is a gland that is situated along the neck, along the middle portion of the neck. It sits in the side of what we call the thyroid cartilage, which is your Adam's apple. So it's surrounded by muscle and a lot of fascia or connective tissue. It is not within the actual throat; it's in the outside. But because we're in the ear, nose, and throat, and we do any neck masses, that's why we are involved to remove them.
Really?
And if you start treating the ear and they don't get to you quick enough to treat the ear, will that manifest itself all the way down to their throat?
Not manifest itself to the throat. If it's a tumor, yes. But we have nerve endings all throughout our neck and our throat and our nose that are all kind of intermixed together. So for example, if you have a sore throat, most people also feel they have ear pain because the same nerve that gives sensation to your throat also gives sensation to a portion of the ear. So one of the signs of, a throat infection or even a neck mass would be a sore throat and ear pain. So those are common questions. Typically though, most people will feel sensation of, if my ears are plugged up, it goes down my throat because there's a tube.
Oh, yeah.
There's a tube that connects the middle ear to your nose, which then drains down to your throat.
Do you recommend, there's something they sell that you're supposed to put in your ear before you go swimming to prevent an ear infection?
No, I wouldn't recommend that.
You don't recommend that?
No, I don't recommend it.
What is that stuff?
I'm not sure.
You don't know?
What I recommend is not putting anything in your ears.
Okay.
Most importantly, because what happens is that if you put something in there that's toxic or inflammatory or acidic, it changes the environment of the ear canal, which then bacteria, fungus can then overgrow and lead to infections. And in the area, we see a lot of fungal infections because it's so moist and people are putting stuff in the ears. That leads to drainage, leads to a lot of gunk coming out of your ears. So I wouldn't recommend putting anything in your ears before swimming. If you want to help with wax, we were talking about that earlier, you can put mineral oil maybe once a week. You can use hydrogen peroxide mixed with water maybe once a week.
Oh, really?
And that will help you.
How about climate change when our soldiers go over to Afghanistan, places like that? Do you see a lot of ear infections and sore throats when they come back?
We see a lot of ear throat infections, not because of the climate change, but because of more of the eustachian tube. So so there's that tube that connects the back of your nose to your ear. When you go to different elevation changes, that tube is opening and closing to kind of help equilibrate the pressure, just like a diver would when you're going down, you equilibrate the pressure. If that eustachian tube doesn't open up well, it can lead to ear infections, fluid, pressure sensations.
Really?
And sometimes people can feel off balance because of it.
Do you ever transplant those eustachian tubes?
No, so we don't transplant those. The treatment would be decreasing the inflammation, anywhere from topical nasal steroids, prednisone. And in the last 9 to 10 months, the FDA has approved a eustachian tube balloon where you can go and inflate it to kind of keep it open.
Oh, my goodness.
Oh, my.
Yeah.
No, I'm guessing not that big, though.
Not that big. Very tiny.
Okay.
There must be different sizes for people with different egos, right?
Good one, Robert. All right, I'm going to take a little break, and during the break, I'm going to go get that thing about the chocolate powder people are snorting.
Okay, sounds good.
This is crazy. There's always something new, right? All right, we will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Partly sunny today with a high of 91 to 94. Thunderstorm this evening, then partly cloudy tonight, a low of 73 to 77. Tomorrow and Saturday, we'll have a late day thunderstorm. Otherwise, sunshine will mix with clouds. We're looking at highs between 91 to 95 both days. From the Florida Weather Center, I'm meteorologist Maggie Johnson.
Hey, Matt, I know Sunrise Automotive does auto stuff, but I need some tires for my truck. Can you recommend someone?
Yes, I can. We do that.
No, I mean, I need them installed and balanced and all that.
Yep, we do that.
Well, my son needed his windows tinted.
Yep, we do that.
I need my
too.
seat replaced.
Yep, we do that too.
And I need a new spoiler and a new truck.
Yep, we can even do that too.
Okay, I get it. I suppose you go to a radio show too.
Well, as a matter of fact, join me, Matt Gibbs from Sunrise Automotive, every Tuesday at 10 for auto repair with personal care right here on The Source.
You've got a garden and we've got a show for you called You've Got a Garden with your host, Master Gardener Carol Ann Baldwin. Carol Ann answers your questions about your flowers, your veggies, your grass, your trees, even questions about your bugs. And she's only on WOCA, so don't miss Carol Ann Baldwin and You've Got a Garden each Tuesday from 9 a.m. to 10 a.m. right here on WOCA The Source.
If you or a loved one is suffering with knee, shoulder, neck, back pain, or tennis elbow and would like to learn how to get out of pain, go to Regenetic.com. Then listen in on the first and third Thursday at 10 a.m. to the people that give you the regenerative medical solutions to your pain. Regenetic, first and third Thursdays, 10 a.m. here on WOCA 96.3 FM, 1370 AM. The Source, Regenetic.com.
Langley Health Services, located at 7205 Southeast Merricamp Road in Ocala, is a federally qualified health center offering family practice, pediatrics, podiatry, dental, behavioral health, and radiology services. Most insurance accepted, sliding scale for those who qualify, and same-day appointments available until 4 p.m. with board-certified family practice and internal medicine physicians on staff. Langley Health Services, call today 352-680-7000. What do I do now?
After 911, don't worry, call Fakuri. Fakuri Medical and Chiropractic, treating auto injuries for over 32 years. Same-day appointments, immediate medical attention, all under one roof. Don't worry, call Fakuri. Go to bestinjurycare.com. All auto insurances are accepted. Available 24 hours a day, 7 days a week to take your call. Car accident? Don't worry, call Fakuri. bestinjurycare.com.
All right, 20 minutes after 11 o'clock. We just learned so much off the air. I wish I could share that with you, too. Dr. Jose Jiron is in the studio. He is the guest of Lauren Debick. Dr. Jiron is an otolaryngologist with Ocala Health. And if you have any anything you want to ask, you're welcome to call. Is that okay, Lauren? Ear, nose, throat, thyroids. We were talking about your larynx, too. Did we include that in what we're talking about?
We haven't, but we do that. Yes, sir.
So somebody who has, for example, one of those speaking things, so they've lost their voice and they use that? Is there...
No, that person probably has had their whole voice box removed.
Oh, so they're
because of cancer.
They have to live with what they've got.
That's correct.
Okay,
and so you
okay.
can use an electrolarynx, or you can do what we call a tracheoesophageal speech, where you use your belly and your stomach to release air to be able to speak.
Oh, but that's hard to learn how to do.
You need a speech therapist to kind of show you techniques.
Really?
For that. Yes,
Wow. If you have any questions, you can call right now, 622-9622. We'll be glad to put you through, and you'll be on the air. However, if you would prefer it to be a private conversation, what would you recommend, Lauren? What do you do?
You can call our consultant nurse number at 1-800-530-1188.
All right.
When people are older adults in their 40s and 50s and they have to have their tonsils removed, I've always heard that that's a bad thing.
Well,
as opposed to being a child.
Well, it's easier as a child. Literally, when I do a tonsillectomy on a child, it takes maybe 3 to 4 minutes to remove because there's less scarring and the tonsils haven't been as inflamed. As we get older, our tonsils shrink. And when you have chronic infections, they tend to scar and they get attached to the muscle that's close by. So when you're removing the tonsils in an adult, which I just did about a couple of weeks ago for concern for cancer, it's just very scarred down. You're higher likelihood to bleed. And when you're trying to prevent bleeding, you kind of cauterize or you burn the edges. And so the muscle is what causes severe pain. Yeah.
So if a person has had to have their tonsils removed as an adult because of the cancer, and then they have children, should the children get their tonsils removed because of that threat of that they might get cancer, or should they just leave them in?
No, not necessarily. Usually it's removed in children for recurrent infections, for those who are snoring and they're gasping for air in children. But it's not something that's genetic, that because I had tonsil cancer, my child is going to get tonsil cancer. Tonsillar cancer is usually due to smoking alcohol and
smoking alcohol,
human papillomavirus. But it's less likely to be a genetic thing.
No, we're snorting chocolate and smoking alcohol. My gosh. So off the air, we were talking about the snorting chocolate, not to be too focused on that, but the listeners heard that news story yesterday. And, I mean, you agree with our gut feeling that that's dangerous.
Absolutely. It most likely will cause sinus infection because you brought the article. It has ginkgo, taurine, and guarana. Some of these medications will help what we call dilate your blood vessels, so you can have more blood flow to your nose. And I'm sure that can maybe cause a little high, but it can also obstruct the sinuses.
Why do we like being high so much? What is it with high?
Some people like that. I'm not sure though.
Yeah.
Individual.
Yeah. I'm fine right where I am.
Just invite Lauren over, and you'll have a high all the time. She's
Sounds
positive.
Thank you.
Oh, that was
nice.
Yeah. People say that about me too, by the way.
Oh, sorry. How do you keep the people healthy in the sports profession? I mean, you've got the boxers, they're beating up on their face all the time. Isn't there a danger that something inside is going to be dislodged?
No, that's a great question. When it comes to Our fractures, we is mostly in the ENT world is mostly because of car accidents
I was
and
gonna
obviously
wonder about that, yeah.
altercations. Professional fighters, they're just going to have a crooked nose until they stop fighting, and then we can fix your nose. But I wouldn't do any surgery for those who are going to continue to cause trauma, because your nose will always be crooked. You'll fracture it, and then if you keep fixing it, you lead to more scar tissue, and then eventually your nose is going to get really tight and it's going to deform. So you want to just make sure you're completely off any trauma related, especially boxing or MMA, before you consider doing any surgery.
It's got to be really tedious for what you do. I mean, all the nerve endings, the eyes, your nose, your ears, it's all right there.
Absolutely.
I mean, you got like 100 billion wires right there going to your brain.
It's very scary, but that's why you do the training, and that's why you go in and dedicate yourself to focus and get the job done.
You mentioned the carotid artery before. Is that part of what you did too, or was that?
We don't work with the carotid arteries, but when we're resecting tumors, we have to dissect along the carotid artery and make sure we remove whatever is away from it. And but yes, it's something that we deal with all the time, but we don't actually go into the carotid artery. That would be a bad thing.
Okay.
Yeah.
When people need hearing aids, sometimes you see the hearing aids that you still can see them over the ear,
Yeah.
and others you can't see because they're
In the canal.
in the canal. Does that harm the inside of the ear at all?
That's a personal decision. When it comes to hearing aids, it depends on the person. Some people who need hearing aids because they can't hear, they really don't care about if it's in the canal or in the ear or behind the ear. Those are the three different types of hearing aids. The in the canal hearing aid, the only downside with that is that it's hard to put in and it's hard to remove. And there's a thing called feedback, which when air goes in through it, it causes distortion within the hearing aid. So that's the downside with it. The open fit behind the ear canal are sometimes better because one, air can kind of help dry it, and there's less feedback and it's a better fit for patients and it's easier to put in.
Do you know what we were telling you about the Children's Craniofacial organization? We went to a picnic down in Orlando for these children, and one of the children was maybe 2 and was deaf, basically.
Yep.
And the mother showed me the video of the first time the baby had a hearing aid put in, and it was just amazing.
Yeah.
You could tell right away that little child suddenly could hear.
Amazing.
And so I wonder what their world is like. I mean, is it totally silent until they get that thing?
They definitely can't hear. If you go to the American Academy of Otolaryngology, there is a video where you can see the differences between mild, moderate to severe, and profound, and they show you on volume. And
oh, really?
Yep, and you can see like how bad even mild hearing loss can be for people, because it can take away a lot.
Yeah.
Since you work with children that need a craniofacial surgery, are you also called in by the plastic surgeons when ladies or men go in for vanity issues, so you can tell them to be careful around the ear or the sinus area?
Yeah, I need one.
No, not mostly for that. Usually that's more specific, and the surgeon who's going to be doing that surgery can counsel them. When you do rhinoplasties or facelifts, which goes behind the ear, the surgeon who's doing it already knows where to go for that. So it's less likely for me to be called for that.
Must be nice doing the radio show for you, because I mean you have to now go back to.
I know.
Oh
I'm
my
on
gosh.
call too.
Oh my God! Are you
my
really?
gosh.
Yeah.
You could've
Good thing you didn't
bolted
get a buzz
anyway.
right now, right?
I know. I was like, who's gonna
Lauren
be
would
my
have had to
backup?
answer
She's
the-
gonna be my backup.
I found it so interesting. Thank you for what you've shared with us today, Doctor. Lauren, do you want to give us info? How do we get a hold of Dr. Jiron? Do we call him directly?
Absolutely. You can call our number and get the physician referral, and that number is 1-800-530-1188.
And I think I've asked you this before. Is OcalaHealthSystem.com? That's the website
That's the website.
for Ocala Health? Okay. Lauren Debick, good to see you again.
Good to see you
as
as
always,
well.
Stay cool. Let's see. We'll see you in August or the end of July.
End of July.
Oh, we'll be back. Okay.
I'll be back.
First and third Thursday.
Dr. Jose Jiron, thank you so much for coming in today.
Thanks for having me.
Good
Appreciate
stuff.
it.
We will take a break. Be right back.
Fox News Radio, I'm Lillian Wu. The president's just landed in Hamburg, Germany for the G20 summit a short while ago in Poland. He expressed support for NATO rallying countries against terrorism.
Our own fight for the West does not begin on the battlefield. It begins with our minds, our wills, and our souls.
The president also urging Russia to stop its destabilizing activities. He and President Vladimir Putin expected to hold their first face-to-face tomorrow, possibly on the agenda.
Yes, North Korea is going to be